Now coming to the flow of an electrical activity across the heart. The pacemaker, that is the SA node, it is producing an impulse. It flows directly to the atrial muscle. Then these impulses, they are traveled to through the internodal connecting fibers to the atrial muscle again, and then they are relayed to the AV node. At the AV node, there is a delay which is commonly called as AV nodal delay, through which the impulses are passed over to the Purkinje fiber and the conducting system, and later on they are carried to the ventricular muscle fibers. Now this is how the electrical potential is being generated from SA node, and it is being depolarizing completely the ventricular muscle, producing a different wavefront in the ECG. Now coming to the characteristics of each wave that is recorded in ECG. Normally there are 5 waves that are recorded in ECG. These are named as P wave, Q, R, S and T wave. Now commonly the QRS wave, they are called as Qrs Complex. They are combined together to known as Qrs Complex. So coming to the very first wave, that is a P wave. P wave, it is a very first wave which is produced due to the event which is called as atrial depolarization. The duration of the P wave, it is 0.08 to 0.12 seconds, and the voltage, it is recorded as 0.2 to 0.3 millivolt on the y-axis. Now coming to the abnormalities of the P wave. The P wave, it is absent in case of atrial fibrillation and hyperkalemia. Hyperkalemia means increased potassium level. The P wave, it is wide and bizarre, which is called as wide and notch in left atrial enlargement, and the P wave is tall and peak in right atrial enlargement. The tall and peak means like this. This is tall and peak, and wide and notch, it means like this. This is a P wave. Now this atrial depolarization will give the P wave. Now what about the atrial repolarization? Now the event of atrial repolarization, it coincides with the ventricular event. The ventricular depolarization event, that's why the waves of atrial repolarization, they coincide with the ventricular depolarization, and these waves are merged with the Qrs complex of this ventricular depolarization. So the wave of atrial repolarization, they are not recorded as a separate waves on the any ECG. Now coming to the Qrs complex, as we have discussed, this is made up of 3 different waves: Q wave, R wave and S wave. They are combined together to call as Qrs complex. The Qrs complex normally follows each P wave. As you can see in this ECG chart or diagram, the P wave, which is a wave of atrial depolarization, it is followed by the Qrs complex shown with yellow color. Now this consists of Q wave, R wave and S wave. This Qrs complex, it represents the spread of electrical impulse through the ventricles, that is called as ventricular depolarization event. The normal duration of this Qrs complex is 0.08 to 0.12 seconds. The Qrs complex, it is produced by ventricular depolarization. Always remember, this is the event which is producing the Qrs complex, having normal duration of 0.8 to 0.12 seconds, with the voltage having maximum voltage of 1 to 1.5 millivolt. The Qrs complex, it is made up of 3 different waves. Q wave, it is the first negative wave. Now the actual cause for this Q wave, it is the ventricular septal depolarization. There is an interventricular septum separating left ventricle from right ventricle. That septum depolarizes first, producing the Q wave. Now the reason for R wave. The reason for R wave, it is the depolarization of the anterior part of the ventricle. Now the anterior part of the ventricle, it is getting depolarized, producing the R wave. Now S wave, it is the second negative wave which is produced due to the depolarization of posterior-basal portion. The posterior-basal means it is the base of the heart, forming the posterior-basal area. It depolarizes last, producing the S wave. Now coming to the various applied aspects related to the QRS complex or abnormality, low voltage QRS complex, it is found in case of hypothyroidism, particularly the myxedema and the pericardial effusion, where there is a collection of fluid, excess fluid in the pericardial cavity. High voltage QRS complex you will get in case of increased muscle mass of the ventricle, that is a ventricular hypertrophy. Wide and desired QRS complex you will get in case of ventricular fibrillation, and the wide QRS complex, it is also found in bundle branch block, which is also called as BBB, bundle branch block. Now coming to the J point, which is commonly called as junctional point. Now what is this J point? This is very important point. It is a point of no electrical activity that is being recorded. It marks the end of depolarization of the ventricle and beginning of repolarization of the ventricle. At this point, all the parts of the ventricle, they are completely depolarized, so there is no current that is flowing around the heart. Heart is completely depolarized, so there is no flow of current around the heart. And this point, beginning of this point, flow, it is known by the J point. It is denoted by the J point on ECG. Therefore, at the J point, the potential of ECG is exactly at 0 voltage. The potential is exactly at 0 voltage because it is reaching to the baseline. Now, the importance of this J point, it lies in case if the J point is moved up. That means, if you consider ECG, so this is the beginning of J point. If this J point is moved up, it is called as ST elevation. It is called as ST elevation. Now if this J point, if it is moving down, it is called as ST segment depression. It is called as ST segment depression. Now this ST segment, as we have seen, what is ST segment as shown in this diagram? The ST segment, it is considered elevated if the segment deviates above the baseline of the PR segment. As you can see, this is the PR segment and this is the ST segment. This is the normal position of the PR segment and ST segment. But if it is being elevated, it is called ST segment elevation. And if the ST segment is depressed below the baseline of PR segment, it is called as ST segment depression. Now coming to the next wave in ECG, that is the T wave. Now this is the third positive wave due to the ventricular repolarization. Now ventricle is repolarized, so there is an occurrence of T wave. Normal duration of T wave, it is 0.27 to 0.3 seconds. And the normal voltage, it is 0.2 to 0.3 millivolt. Now coming to the abnormalities of T wave, you may get a tall T wave in case of hyperkalemia, that is increased serum potassium level. You may get small and flat or inverted T wave in case of hypokalemia, that is decrease in potassium level. You may get inverted T wave in case of myocardial ischemia or infarction. Now coming to the another wave, that is a U wave. This is a very rare wave which is produced by the slow repolarization of the papillary muscles, and this U wave, it is very rarely seen in the ECG. Now coming to the various intervals and segments of ECG. Coming to the first, PR interval. What is PR interval? It is the time taken by the impulse to travel from SA node to ventricle, and it is from the beginning of P wave to the beginning of QRS complex. So if you consider this as an ECG, normal ECG, showing a P wave, this is Q, R and S, this is a T. So what is PR interval? It is from the beginning of P wave, so this is the beginning of P wave, to the beginning of QRS complex. So this segment, it is your PR interval. Normal duration it is 0.16 to 0.2 second. If the PR interval it is more than or prolonged than 0.2 second, it is indicative of partial heart block. It is indicative of partial heart block, which is a common feature in rheumatic heart diseases. That's all from my side. Thank you all. Thank you. Have a good day.